This is Channel 7 News Good Morning Arkansas.
Well, most of us probably take a multivitamin every single day. Recently, some new recommendations have been released about multivitamins, and Dr. Morgan Sauer from Baptist Health joins us this morning to tell us the latest findings. Dr. Sauer, good morning. Thank you so much for joining me.
Good morning. Thank you for having me.
Yeah, so over-the-counter vitamins, so common in our everyday lives. So what are these latest findings?
Interestingly, the United States Preventive Services Task Force has come out with new recommendations about adults who are taking a daily multivitamin. This is a $50 billion industry in the U.S., with 1 out of 3 adults taking a multivitamin each day. However, if you do not have any nutritional deficiencies, there is absolutely no benefit in terms of reducing your risk of death, cancer, or heart attacks. This data has been actually collected over 30 years now, and it keeps saying the same thing.
So are you saying that we just don't need to take vitamins anymore? What does this mean exactly?
It can be a little confusing, and it's important to recognize sometimes you do need vitamins. So for instance, if women are going to become pregnant or are pregnant, it's important to take a vitamin with folic acid and iron in it. Certainly if people have vitamin deficiencies like B12, vitamin D, folic acid, it's important to take vitamins as well. If people do not have access to healthy and nutritional foods, a multivitamin might be appropriate in those situations. Also, some people have malabsorption, where their gut just doesn't bring in those vitamins properly, or they're on medications that cause this, and that is a time when it's important to do it. But we also have to be careful about vitamins because you can overdo it. Beta carotene can increase your risk for cancer and give you some liver damage. Vitamin D can cause milk alkali syndrome, and other vitamins can actually cause problems with people bleeding. So it is about being in balance, but the multivitamin, if you're healthy, not worth it.
So these recommendations mentioned heart disease, cancer, and death. But what about some other events that have been studied with multivitamins, like memory loss?
There's a Council for Nutritional Research, I believe is their name, and it's a trade industry group, and they've been highlighting on some of their talking points about different illnesses like memory loss or cognitive decline, and pointing to some studies saying there may be some benefit inside of this. Interestingly, the recent study that came out of North Carolina from Wake Forest showed that there might be a little bit of benefit with this. However, this is a third size of a study that was actually done in 3 times the size a few years ago that showed absolutely no benefit. It also hasn't been put into a peer-reviewed journal, and from reading the study, we didn't even look for vitamin deficiencies before. We know if you're fixing a vitamin deficiency, yes, you're going to do better. So I think that it's a good study to say, you know what, we may need to look closer at this, but really trying to promote something that's not been shown to be effective, I wouldn't jump on that boat yet.
If this doesn't give that much benefit, why is this a billion-dollar industry?
Part of it is because we like to be in control. We want to feel that we have control over something. And so vitamins are interesting. You'll go and see someone that's got a bottle of multivitamins, and then they have one of everything that's in the multivitamin. And it's about trying to take control of something that you actually have some power over, but it doesn't come from a pill. Going out and eating a terrible diet and then taking a multivitamin does not make you healthy. What control means and what control should be is working together with your healthcare team in a collaborative effort, and including educating yourself and buying fresh fruits and vegetables across the spectrum of colors to help fuel your body and provide your body with what you need.
You had mentioned prenatals earlier, that those are important to take. So what about young children? Is this something that's important for them to be taking a vitamin? Like, I had my Flintstone vitamin every single morning. Like, should kids be continuing to do that?
This study actually did not address do children need to have that? And one of the big questions that we have is, we certainly know, especially falling on tough times, that access to quality food can be problematic for children, and serving them high processed foods that are not nutrient dense and that do not have added vitamins can be a risk. So I would say at this point it really is still important to make sure you get a wide breadth of healthy fruits and vegetables to provide the vitamins you need, as well as lean meats. But if there is concern with that, children should have their parents talk to the pediatricians and find out what's right for the children.
Well, this has been an interesting conversation for sure. If somebody's interested or just wants more information, where do they need to go to find out more?
Certainly calling the Baptist Health Line and getting an appointment with a primary care physician who can work together with you in a collaborative way to build your health and build healthy lifestyles that'll protect you for the rest of your life.
Perfect. Dr. Sauer, thank you so much for joining me this morning.
Thank you for having me.